now let's go to the next questions, maybe relating more about what do you want to say to the new generation of psychological practitioners, maybe not just psychotherapists, but also psychiatrists and social workers who would also work with patients. To the new generations of psychotherapists who are interested in TFP, do you have any suggestion or reminder, for example, how to deal with one's countertransference, how to take good care of themselves? Or is there any basic attitude one needs to hold to become a good TFP therapist before they really devoted their time to learn TFP? What do you want to say to them? Yeah.
So let me answer your question about the personality. First of all, of course, we need a therapist who is intelligent, knowledgeable, interested in seeing people and helping. The therapist can have all kinds of personalities, but therapists who have strongly narcissistic features have greater difficulties than therapists who don't have serious narcissistic problems. So for therapists with narcissistic difficulties, definitely treatment is indicated if they want to become psychotherapists themselves. This brings up the question whether every therapist who does a form of psychoanalytic psychotherapy should have personal treatment, psychoanalysis, psychoanalytic training, or psychotherapeutic experience or not. I think that it is not necessary that every TFP psychotherapist have psychoanalytic training. No. But every TFP therapist should have a good knowledge of psychoanalytic technique. And the psychoanalytic institutes don't teach well psychoanalytic technique. So we attempt to teach psychoanalytic technique better than the psychoanalytic institutes. We are working on that. We are really working on that. Proof of the pudding. There is not a single integrated text on psychoanalytic technique. And we have already 3 editions of text of the transference-focused psychotherapy, 1 text on the application of transference-focused psychotherapy for a healthier patient, 1 text of transference-focused psychotherapy for narcissistic patients, and we are about to publish. We have a book of transference-focused psychotherapy for adolescent patients. So we are very sharply interested in defining technique, and the therapists should know, they should know psychoanalytic theory and the technique of, and psychoanalytic technique in order to carry out transference-focused psychotherapy. They have to be, they should be honest, but should be flexible enough not to have too rigid viewpoints, so they can tolerate working with patients with different orientations and viewpoints. And as I said before already, they should be able to tolerate aggression in themselves and in others. It helps if they have a rich sexual life and the capacity of if they have an intimate relationship so that they can have the freedom and the experience to study the sexual difficulty of patients with severe personality disorders that are more difficult to study than the difficulty at work and profession, because there are so many social taboos about sexuality, so many inhibitions and fearfulness to deal directly with sexual problems, that we see it as a particular task to train therapists to be able to explore this fundamental area of human experience. So freedom in experiencing and tolerating aggression, freedom in experiencing and tolerating sexuality, and a rich personal life. It helps if the therapists have life experience, although younger therapists may, with consultation, help complement whatever experiences they have about unusual situations that have not yet occurred in their own life. It helps if the therapist has gone through mourning experiences, through object loss, severe couple conflicts, institutional conflicts, social conflicts. But the importance of all of this is the development of a personal maturity of the therapist as an individual, just an ordinary maturity that the therapist shares with non-therapists. It's nothing unique, but the therapist has to be able to use his own maturity to create the image of what the patient might be ideally and what the patient is missing. And the ideals for the patient of the therapist are a fundamental aspect for the success of the treatment.
Okay.
The more the therapist has a vision of what the patient might ideally be, knowing that there are limits and we never have anybody who is perfectly 100% okay, but within human limits, the broader the wishes for the patient's high level of functioning, the better the treatment. So these are elements. Regarding knowledge, I think that one can become therapists from different clinical areas, but if one wants to be a TFP therapist, one has to learn psychiatric pathology and diagnosis. And for psychologists, social workers, philosophers, other experts who want to become TFP therapists, they have to have an experience in a psychiatric clinic where they see real patients and learn to make differential diagnosis and learn all treatment approaches. So I think that a solid psychiatric semiology and overall diagnosis and treatment are important. And as I mentioned already, knowledge about psychoanalytic theory and technique, we teach the patient what are the basic techniques that we pick up from psychoanalysis and how we use them. Our basic techniques are 4: interpretation, transference analysis, technical neutrality, and countertransference utilization. And those we study in great detail, and we have modified so they are different from the way they are used in psychoanalysis, but these are basic for psychoanalysis as well. In fact, these are the 4 basic techniques for all psychoanalytically oriented treatments. What we have done is to become more specific in defining them and teaching how to use them. And so we have developed complex understandings of each of them, what we call interpretation, how we do it, what we call transference analysis, when we do it, what we mean by technical neutrality, how to utilize countertransference reaction. All of this we teach in great detail, and we use it in every session with the patient.
Yes. Okay. So it's so nice to hear so much from you. It's really fruitful to listen to you.